everyone. Good afternoon. I hope you're enjoying the event so far. My name is Michelle, and I would like to introduce to you our speaker on the topic of health and safety today. We have Janet Sellery joining us. She is one of Canada's leading experts in health and safety in the arts, entertainment, and live events industry. She's an active volunteer, chair of Event Safety Alliance Canada, and a board member for Event Safety Alliance in the US. Her work as a health and safety consultant with Sellery Health Safety focuses on customizing programs, training, and resources to reflect the constantly evolving and unique demands of our work. During this pandemic, she has been working hard to support the events community as we all figure out how to return to the work we love and do best. Welcome, Janet. I will turn it over to you, and I will rejoin at the end of the presentation.
Wonderful. Thank you very much. So hello, everyone. I can't actually see your shining faces because I have my presenter view for my presentation, but I have joined you directly from a Ministry of Labor Live Performance Advisory Committee meeting that started at 10 this morning. So this is very much information I'm talking about most of my waking hours. Quick disclaimer before I get started, I am not a lawyer, doctor, public health expert, and we're all aware that the understanding of COVID-19 is changing very rapidly. So it's important that I'll give you some ideas, but wherever you are joining us from, you need to comply with all of your local requirements as they apply to your specific circumstances. So I just want to introduce this conversation by letting you know that I'm going to be talking to you about how to plan, but I can't look in the crystal ball to say when or if we're going to reopen. And I'm not going to be able to address all of the regional specifics because, as we know, across this country, there are very different restrictions in place. What we do know is that COVID-19 is this pesky virus spread through respiratory droplets and aerosols. It's highly infectious, causes mild to severe illness and death, and currently there is no vaccine or really solid treatment plan. There's a lot of unknowns, but we do know that spending time indoors together spreads the virus. This is the first disease to widely close businesses since the Spanish flu in 1918, scrolling back more than 100 years. Despite all of these difficult closures, I know that this can be a richly creative and innovative time. And I want to acknowledge the excellent work being done by a lot of service organizations and individual companies. So when we look at reopening, we have two big priorities. First, we have to keep our workers healthy and safe. And second, we need to create environments where attendees will feel confident to return. And this requires some sort of almost a social contract, not a written contract, but just an overall agreement where we will all agree to take precautions to protect each other. At this point in history, effective health and safety protocols will be the most important factor in successful reopening. For now, workplace health and safety and public health and safety are equally critical. You cannot have one without the other. We can't expect our attendees to return with confidence until we've taken precautions to protect our own workers. So I'm going to give you a flying visit to occupational health and safety legislation and public health legislation. When it comes to health and safety, Canada has 14 jurisdictions and each have their own laws. These legislated requirements are minimums and reasonable practices often will exceed these laws. COVID-19 is an occupational health and safety hazard, just like hazardous materials, slips, trips, and falls, and working at height. Across the country, we all have occupational health and safety rights, which include the right to participate in the activities that affect our health and safety. We have the right to know about hazards and how we're protected. And this is all about having appropriate training and information. And we have the right to refuse unsafe work, as well as the follow-up to that, the right to be free of reprisal. So we cannot be disciplined or fired for using our occupational health and safety rights. We also, anytime we have rights, have responsibilities or duties, and it breaks down into three main groups. We have the employer, who has to provide a healthy and safe workplace, and this is done through the development of a health and safety program and also providing resources to implement that program. Things like safe equipment, like training, all of the various equipment guarding, all of the things that we need to stay safe on the job. We also have supervisors who must take all the precautions necessary to protect the workers who they are responsible for. And supervisors need first and foremost to be role models. They need to demonstrate their compliance with all of the rules, and that will certainly make it easier for workers to comply as well. Supervisors are responsible for implementation of policies and procedures, as well as enforcement, making sure that people comply in their areas of responsibility. And then all of us who get paid for any type of work have a duty to take reasonable care to protect ourselves and others. So workers in this context, I include volunteers, because we should not be forgetting about them when we have put programs in place. But as workers, we need to comply and we need to report things like hazards, injuries, and incidents. So typically when we're looking at occupational health and safety, we're really focused on the safety piece of it. But in the context of COVID-19, employers have a duty to provide a healthy workplace too. So it's not just about OHS. With this particular virus, we're also really heavily involved in public health legislation. And this breaks down into several different jurisdictions. At the federal level, they will take care of things like border closures. Provincial and regional government will establish restrictions on businesses and public spaces, whereas municipalities may develop some mask and face covering bylaws. So it's up to you to identify what requirements apply to your business based on where you're located. What kinds of things do we hear from public health? Well, we're all very much aware that we need to do physical distancing of 2 meters, but there are a few exceptions to that. In each jurisdiction of Canada, we have some places where we can establish small groups. They're called different things in different places, but these include the social circles, the bubbles, the core cohorts. And whatever we call these small groups, these are the same people who can interact regularly without staying that 2 meters apart. We should have little or no close contact with those outside that group. And the reason why that's important is we want to reduce our chances of getting sick, but also make it easier to track exposure if someone does get sick. Other things that public health may restrict are things like gathering sizes. For those of you in Ontario, we have recently had a new restriction involving gatherings that are not supervised. So family parties, weddings, funerals, those kinds of things have been reduced to a group indoors of 10 people or outdoors 25 people. And this, again, varies across the country. One of the things that we do know is going to maintain restricted for some time is the major festivals and concerts, large conferences, trade shows, and events. So that's just a really flying visit of the kinds of legislation that we're all needing to keep our eye on. When we get into planning our COVID-19 response, there's a number of different tasks that are involved, and I've given you a short list here. So let's look at them individually. First and foremost is risk assessment. I'm a huge fan of risk assessment because most of my work is theater, but more generally arts, entertainment, live events. All of the projects are very unique, and risk assessment is a tremendously powerful tool where we can identify hazards, assess the level of risk, and figure out what are the sorry, I've been talking since 10 a.m. I apologize for stumbling over my words. Identify practical measures to control the risk. Those are our precautions. When we begin to look at risk assessment, we need to look at all of the activities that are involved in the worker and the attendee journey. So what happens when they arrive? What do they do while they're at your venue? And how do they leave? Do they leave all at once or do they leave a few at a time? That makes a real difference. You can use your risk assessment to develop your controls and lay out all the precautions you'll take related to COVID-19. And once that's complete, then you can plan which activities you can reasonably begin. So one of the really good things about risk assessment is the way you can scale it to suit your business. If you're a gigantic convention center, risk assessment is valuable. If you're doing a very niche, small get-together or meeting, it's equally valuable. You're just going to apply it based on your own unique circumstances. One of the things that used to be something you would have to study health and safety to learn about is the hierarchy of controls. But I know we're all seeing it in the news, online, it's everywhere. And this is that upside down triangle that identifies the effectiveness of different types of controls. So we can see our blue line at the very top is our most effective control, whereas at the bottom in the red is least effective. So how do we apply this to COVID-19? Well, obviously, the most effective thing that we can do in terms of our events is we can stay home. So at the top of the scale is elimination. We eliminate the hazard by staying home or by, taking part in seminars, webinars, panels, exhibits that we can carry out online, just like we're doing right now. Substitution is another control that you can take advantage of in case of some hazards. Things like if you're using a highly hazardous chemical, you could substitute that for some that is not so toxic. Now, when it comes to COVID-19, we don't get to make that choice. We don't get to say, well, we're not going to have any COVID-19. We're just going to have a mild cold. Not available to us. So next we move on to look at engineering controls. This is often physical barriers such as the glass panels that you will see in shops and businesses where you go to make payments or any of those kinds of activities. Engineering controls are really useful because they physically separate a person from a hazard. We also have a great number of administrative controls that we're seeing applied, all sorts of policies and procedures, hand washing regimes, limits on our gathering sizes, and that ever popular physical distancing. Finally, at the bottom of our hierarchy of control is personal protective equipment. This is where we include masks and face coverings. So what you can see from this diagram is it's equally important to consider all types of controls. It's not going to be good enough just to slap on a mask. We do need to consider all of the other ways to prevent infection from COVID-19. So let's look at a couple of examples. So when it comes to engineering controls, first and preferred choice because they physically control the hazard. I'm showing you a picture here of the Brett Kissel concert in Saskatchewan, and you can see all of those barriers to protect the different musicians from the spray of aerosols. So that's one thing that's becoming quite common. We're also encountering in our day-to-day life lots and lots and lots of administrative controls, and you'll often see these as signage, stickers on the ground, safe work practices, training, purchasing. So we can get lots of protection through all of those activities. And finally, our precaution of last resort is our PPE, our personal protective equipment, which we use in combination with our engineering and admin controls. And what PPE is really good at is lessening the harmful effects of exposure to a known hazard. So that's why we're all creating these fabulous wardrobes of face coverings right now. So risk assessment, I think, is the best tool for you as you're looking at how you might begin to reopen or begin to have your first events. Another area to assess is your venue. And there's some great tools that can help you do an audit of all the areas that your event might use. So everything from your offices, your exhibit areas, conference rooms, and then the break lobbies and washrooms, things that are sort of more public access places. You're going to need to do some figuring out of capacity limits for both workers and attendees. And you'll need to do a good deal of planning around physical distancing during ingress, when people are entering your building, when they're circulating during the event, when they're egressing, leaving at the end of the event, and also keep in mind emergency egress. Obviously, if the fire alarm is blaring, people are going to need to get out. They're not going to be staying 6 feet apart, but you need to think about your gathering place. Where are people going to meet up after they get outside? And how can you make sure that they are distanced at that point? Additionally, when we're thinking about our venue, this has been something that's been a real focus, especially as a lot of events are trying to figure out, can they go ahead? Is it going to be financially viable? And a lot of that has to do with capacity. So the capacity of a venue is a fixed number. It's based on 2 factors. One is the locally permitted maximum gathering size, and the second is physical distancing requirements. Whatever is the lowest number, that is your patron capacity. So for example, if we are in a place that has a permitted gathering of 100 people, and we have a venue, let's say it's a theater venue, it has 1,000 seats. Your patron capacity is 100 people. If we have a permitted gathering limit of same 100 people, but our venue only has 250 seats, when we do the measurements for how much space we need to allow for each person to accomplish appropriate physical distancing, we find that this venue will only allow us to have 50 people. So that means our patron capacity is 50 people. So, that's a very discouraging number for a lot of organizations and businesses to try to get their heads around. But the only way to gather more people together is to put them in more space. So I've heard it said, fewer faces, bigger spaces, which is, it's tough from a business perspective. So we look at our risk assessment, we do our venue assessment, and then the next thing is to really think about programming. At this point, it's important to consider alternative programming like the setup we have for today. A lot of events are moving to live streaming, maybe pre-recorded sessions. I've heard about virtual reality, although I haven't attended any of those ones, and all kinds of other digital experiences that will be able to bring people together to establish a sense of community and allow for those interactions to take place. Once you've done all of these assessments, your next important step is to identify programming that can realistically be presented safely. And initially, we may be looking at things like individual speakers, small panels, if we're going to do sort of in-person events. All right. So I've talked to you, and I'm talking quickly because I know we don't have much time, just in case you were wondering. We've done a bunch of assessment, and then we come to the point where we need to prepare a healthy workplace. First and foremost, if you're the employer, you need to recognize your duties to provide a healthy and safe workplace. Consult with your worker groups, associations, and unions to find out what do they need to feel safe about returning. And also consider any people, it might be workers, it might even be volunteers, who could be vulnerable due to their age or pre-existing health conditions. So now you've got a whole ton of information, and you need to be developing precautions for each activity. Once you've identified all the different precautions, policies, and procedures, you're going to compile that into a COVID-19 safety plan. Now, many jurisdictions have templates for COVID-19 safety plan. Ontario has one. British Columbia has a really terrific one, which they even offer as an app. So that's where you're going to gather all this information together into one plan. As part of it, you'll be preparing both general and departmental policies and procedures. And I want you to think about the life cycle of your event as you figure out which policies and procedures you need. Start from the point where you're planning, you're first contemplating your event, and then carry that through all the different phases, right up until, you've done your pre-production, you've done your load-in, your setup, your event day, your strike, your load-out. All of those phases need to be considered, along with the journey of the workers and the attendees. Once you've figured out how you're going to set that down in terms of policies and procedures, it's important to make sure that you have planned to have good, solid implementation and compliance. You need to figure out what consequences there will be. So if you have a worker who declines to comply, how are you going to deal with that? I recommend distributing your information out to your workers in advance so they can read it and agree to follow it before they come back to the workplace. You also need to spend time supporting your supervisors, as they are going to be the ones who will generally need to be enforcing compliance. Once you've done all this planning, you need to have a little think about time, people, and money. Are there going to be changes you might need to make to your schedule in terms of staggered shifts, patron arrivals, looking at session lengths, longer breaks, no breaks, and so on? Spend some time looking at your people. Do you need to have additional staffing to carry out cleaning, screening, supervising physical distancing, managing lines, and so on? Looking at your staff, make sure there's no penalty for reporting illness. You do not want people to feel that they have to come in. You really want to encourage them to stay home when they're sick. And this is often going to involve paid sick leave. If you really want to be sure that people are okay with not coming in when they're sick, they're going to need to feel comfortable that they're not going to be at a greater financial loss after all this time off work. Assess your budget. Is this change in schedule or change in staffing going to add additional costs? You may need to buy some things in terms of screening, cleaning, PPE, and ventilation. And then once all that's known, you can allocate your resources. What kind of budget and what kind of staff do you need? When it comes to venues and exhibitors, you need to review contracts to clarify who is going to be responsible for which tasks related to health and safety. In all of your new agreements, make sure you're clear about new responsibilities and the authority to carry out and enforce them. The exhibitor is going to really want the venue to be clean, and the venue is going to want to know that the exhibitor won't bring unreasonable risk onto the premises. So really, both sides have a vested interest in keeping people healthy. And it's really good if you can sort that out before you're in the throes of your actual event. You're going to need to get onto communication and training, both educating your attendees and your workers. And think about some time, you may need to allow time for procurement to get all the different things you're going to need to have in place. And once you've actually got your workplace open, your events are running again, be sure to plan for some time to monitor and evaluate how things are going. Survey your workers and your attendees. It could be something as simple as a quick SurveyMonkey poll to find out whether they felt safe, what went well, what needs improvement. Once you've identified areas of concern, you can plan to respond, change, and update as needed. Now I want to share with you some resources that you can use to begin your planning. In all cases, you need to consult your local public health requirements. And when you're looking at resources, make sure that you are referring to credible sources. They should be current. Now, as we get new information, guidance will change. It's not because it was wrong before, that's just how science works. So you have to make sure you're looking at things that are, not necessarily from last March. You want to look at information that's local. That's the information you must comply with. I certainly encourage you to look at global guidance. It will give you some good ideas, but you need to make sure that it's a fit with whatever your local requirements are. And also the information should be relevant. So there are lots of resources around events and conventions and trade shows. And you may also want to look at things that relate to certain parts of your business. If you're, dealing with food and beverage, there's some really excellent information out there about restaurants. If there's a lot of merchandise sales, you can look to some of the retail. And there's lots of different types of gatherings which have been putting out guidance that may be useful for you. I do caution you that we're right now in a period of time where there's a lot of studies underway. Some of them are being published quickly, often without peer review. So take them with a grain of salt. Watch out for magical thinking and unreliable online resources. Give you some ideas about resources you can look to. This is a presentation which is being shared, so you don't have to jot all this down. You can just save the presentation and go to the links. Canadian Exhibition Industry Safe Reopening Guidelines came out in June. And I think one of the really good things about this one is it's got a very clear identification of the responsibilities of the venue and the organizer. So I encourage you to look at that just in trying to figure out who does what. City of Toronto has come out with guidance for indoor and outdoor events and gatherings. And within that, they do touch on professional meetings and event venues, everything from convention halls, hotels, banquet halls, and conference centers. And when if you're in Toronto and you're operating in compliance with an approved plan, you are permitted to have up to 50 people per room. So the initial gathering size requirements came out. It was 50 people per building, but they have since extended that. So if you're doing, if you've got an approved plan, you can have 50 people per room of your building. But trade shows and events that require people to mingle are still prohibited. They also say that they've got quite a good little description of the things you need to do, which will by this time sound familiar. There's an expectation that you will assess risk, but also your ability to mitigate those risks. They will expect you to implement measures to reduce the risk, and that includes the management of lines or crowds. Another document that I think is quite useful is from the Alberta government, their guidance for trade shows and exhibiting events. Theirs is quite different. They're saying that as long as you can physically distance, there is no maximum limit on the number of attendees at trade shows and exhibits. They do say that if you're going to be doing product demonstrations or presentations, you need to allow additional space to maintain that 2 meters of distance. They also advise discouraging attendees from handling products. So that makes sense. You don't want a lot of people touching things unless they are suitably disinfected. All right, then off we go to the Convention and Exhibition Center Health and Safety Managing COVID-19 Challenges. This is a document from a couple of international associations which have gotten together, AIPC and UFI. This is from back in March, but it has some quite good reference information for you. We've got another one from World Travel and Tourism Council about leading global protocols for the new normal. They've got, sections about their overarching objectives, operational staff preparedness, ensuring that staff experience. And this is a good one about rebuilding trust and confidence. So the kinds of things that you need to be doing to, encourage people to come back. I also like this one from PSAV. It's their Meet Safe Guidelines Playbook, and they offer information about meeting design, room layout and traffic flow, some technology considerations and cleaning requirements. And you can see from the picture I've included, they show a traditional meeting room with round tables and how that can be reconfigured to include the distancing. Now, one thing you may find a little discouraging about this one is we've gone from a capacity of 110 people down to a capacity of 24 people. So that will be certainly challenging for events that need bigger groups. And this is, I have to say, I'm very fond of the Event Safety Alliance Reopening Guide. This was one of the first out of the gate on May 11th, and this is one that I was involved with, along with 300 other people who were crowdsourced it. The information is very, very good. It holds up over these last few months. The only thing I would say has probably is probably not super applicable for us is the temperature taking. So they speak a bit about that, which we now know is not exactly the silver bullet, maybe suitable in some situations. So that's a flying trip through a bunch of resources. But if there is something specific you're looking for, just get in touch with me and I'll see what I can find. So baby steps. So you're ready to have your own in-person live event. Plan for something small to test out your procedures. Build confidence. Communicate your expectations and tell people how you're adhering to the health requirements. This is no time to have your cleaners hiding. We all want to see someone out with a bottle of disinfectant, wiping down door handles. And, we want to see those protocols in action. You're going to monitor, evaluate, and make changes. Watch what's happening in other places because you can learn from that. And really, you've got to be prepared to pivot and shut down again if cases increase. Get it right the first time or your whole industry will be affected. And we've seen that happen in some countries where, you'll have nightclubs have a whole lot of infections. And that really doesn't affect a big swath of the industry. Your plans need to be proportionate. You need to scale them up, scale them down, and they really need to be uniquely your own. Looking into the future, our new normal, we are still in the acute phase. We are still pre-treatment. We are still waiting for a vaccine, and we likely will be for some time. We need to anticipate that physical distancing will be needed for months and perhaps a couple of years. Masks and face coverings are here to stay for quite a while. So, keep adding the fun ones to your mask wardrobe because you're going to need them. We're also going to see some permanent changes. We need to be protecting against the second wave, which some may say in Ontario has already begun. We need to also be concerned about seasonal influenza and the next pandemic. So some of these changes we're going to have to live with, and we're probably going to, do well to invest in them. Think about programming so you're ready to pivot down to something small. Look at operational improvements such as no contact payments, automatic doors, apps that may allow people to pre-order or order from their seat, food and bev. And look at your venues. If you're responsible for a venue, can you reorganize or renovate for healthier ingress, circulation, washrooms, and egress? And just in summary, your reopening plan needs to be as unique as your business. Be realistic about your ability to resume safely. We know it's going to take a while. Collaborate with other organizations to plan cohesive requirements. And, within the event community, creativity and problem solving are our superpowers, and they are needed now more than ever. Be confident in your expertise. Remember, all of this work is towards keeping our workers healthy and creating the environments where attendees feel comfortable to return. I just want to remind you that tomorrow night is the day of visibility for the live event community. And I encourage you to put up a red light bulb or even take a flashlight, put a little red gel in front of it. We're all going to be lighting our venues up red to recognize and be visible, to show the community how many people are involved with live events. And with that, I'm going to open it up for questions. And my contact information is also available. So I'm going to jump back and say hello.
Hi, Janet. Thank you so much.
Zoom, 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 zoom.
Here I am back in. Are you comfortable if I share your website in the chat here for contact information? So I'll go ahead and post that in the breakout session. If anyone does have a question, now is the time to post here in the breakout session chat room, where I just posted the link to Janet Sellery to find out more. Thank you so much. I think it's extremely important for us to know what resources exist for reading material, understanding globally, nationally, locally, how things are progressing, evolving, and especially with those change in regulations and the definition of gatherings and limitations. I also think, not only are we eager and excited to change our events and how we'll execute on the event, but also to look internally for our own workplaces and getting the comfort of our employees to return to work. So thank you for touching on that as well. It doesn't seem like we have any questions coming in, so I assume you answered everything.
I don't know. I talked really, really fast.
Well, it was great. Speed was fantastic. You're welcome to stay around and join our speed networking or look at some of the exhibit booths. Hopefully our paths will cross in the event platform. But thank you again to Janet Sellery and all those who tuned in today to talk health and safety with us. Thanks, Janet.
Thank you.